You are listening to On the Record with Tiffany and Kevin on 9:30 a.m. The Answer.
As the descendants of freedmen, we're providing an unapologetic, Black-first, radical Republican perspective on health, business, politics, and culture. All right, Tiffany. Okay, so this week's section is on, we're going to talk about health, all right? And we're going to do, I think when we were preparing for this, you were talking about initially asking me questions about some of the things that I've seen just as I've been a consultant with you, right?
So what have you seen?
What have I seen? Just as being a consultant to the foundation as an outsider, right? Because I think you've been doing this for 5 years. Kind of the main theme, and I kind of sort of already kind of knew these just as a patient who infrequently goes to the doctor, right? Is that from my view, right, you have to self-educate yourself, right? Especially in the area of nephrology. If you're a kidney patient, I would imagine the same would be if you were, heart diabetes or whatever, is that you really have to do a lot of self-education. And unfortunately, there's just so much that's out there that is, confusing, misinforming, et cetera. So for me, I found just in that self-education process, the best websites are going to be the one from the National Institutes of Health. Right. So like with kidneys, diabetes, right, it's going to be the NIDDK. I think it's niddk.nih.gov. It's a long one. But that website has the best information as far as like the details there on that. So
that's
yes,
true. That's where everybody gets their information from.
Yeah, that's true. Everybody's pulled their information from the niddk.nih.gov website. I mean, there's a lot of self-education that you have to inform yourself. You got to self-educate yourself. That's the first thing. The second item, just from my viewpoint that I see that we have there, is that it really feels like you're kind of on your own in the sense that you've got to self-educate yourself. You've got to empower yourself with knowledge, right? And then also it feels like, right, you have to be your best advocate. I think you say that a lot, and that's really true. You've got to be your best advocate because the healthcare industry is really, it's a profit center. Right, and a profit center in the sense that they take care of sick people. They provide sick people with the best health care available, right? Once you get into the system, but you really have to advocate and get yourself into the system. By into the system, I mean you got to find the doctors, because when you're looking for information on doctors, they all look the same. They all have medical degrees, and you're trying to figure it out, right?
Well, what you're describing is there's not a system that is made to make you better. Mm-hmm. This system is made to take care of you while you're sick. And that's where the profit center is in taking care of you while you're sick. So if you want to get better, you're going to have to be the one who comes up with that plan, because that's not the plan they have.
Yeah. And then just also, and it's not customer friendly. It is not customer friendly. It is not where I call, they're like, hey, Mr. Smith, we're glad to help you, right? We want to help you and get you in the right lane and everything. It's just not, right? And then when you go or you call up those practices that are customer friendly, that do treat you with dignity and respect, you're just like, where do these people come from? Or they're aliens, right? And it always feels like you're like, wait a minute, something's going to go wrong if you find a really good practice or hospital that has very customer-oriented practice right around it. So that's the thing that I found there. And then also, go ahead.
Why is that?
What do you mean?
Why do you say they're not customer-oriented?
Perfect.
Is it the amount of time they're spending with patients? What is it?
I would say it's the amount of time that they're spending with the patient, right?
How much time do they typically spend?
Typically they spend, and I don't know if there's a study, I'm just basing, it's about 3, 5, maybe 10 minutes, right? That they're seeing you on average.
There is a study, and it's somewhere between 3 and 5 minutes.
3 and 5 minutes
that the average physician spends actually talking to the patient.
And you got to come in with your list of questions, because you can't just be like, hey, how's the family? Let's catch up. No. You got to have your list of stuff that you're coming in there with, and have the questions. And sometimes you have to be pushy to get those questions, right? Because that's the why. You got to have a structure. You got to have come in with a mental structure in mind of the questions and concerns that you have. Have those written down, and not rude, but kind of pushy, right? In some cases, to say, hey, these are of a concern for me, and answer the questions, and have done your research from a reputable website, and not something you just randomly got, right? And I would say, and I push this, right? The NIDDK.nih.gov. That's the starting point if you have diabetes or some type of kidney issue. Wouldn't you say?
If you've been diagnosed with diabetes, hypertension, cardiovascular disease, if you have obesity, if you have any of those, then you're going to want to ask very specific questions about your kidneys. You want to know what your estimated glomerular filtration rate is. Mm-hmm. You want to know how are my kidneys functioning? How were they functioning last year? How are they functioning the year before? So you can see, are my kidneys declining in function? If they are, why? And is there something we can do to mitigate that decline? There are things that you can do. So, and a lot of it resides with diet and exercise.
Yeah, and that's the other thing too, is you're bringing up the numbers. You got to know what the key numbers are, right? So in the kidney world, the key numbers are eGFR, it's creatine, I always say that wrong, creatine, and then albumin, right? Mm-hmm. And you've got to track those numbers across time, because oftentimes you'll get the number, and the number is sort of what I refer to as out of context.
It's not it's out of context, and it's not intuitive.
Yeah, it's not intuitive at all, right? And so it'd be essentially like me coming to you and say, hey, invest in my business. I made $1 million last year. You're going to be like, okay, but how much revenue did you have to generate? How much, how much revenue? How much did you need to invest in the company? Whole list of things, right? And you want to see that across time. So if in that business example, right, if I say invest in my business, it made $1 million last year, but it took $1 billion in revenue, you'd pause. And then if I told you last year it took $2 billion and we didn't make any money the previous year, you would see, wait a minute, I think we're going in the right trend. But you'd have something to compare it to year over year, right? Understanding what the numbers mean, and then seeing the numbers movement up or down. That's the other thing that I find that you have to know as well, right? And then the other thing which I think is interesting is that that you unknowingly, right? Sometimes your choice is limited, right? Where you have to stay in network, and you can't go out of network on that one, right? So your doctor, you have this one doctor, and you've got to stay in the network, and you can't go out, right? So I think that limits, a lot of times it feels like it's limiting patient choice on that one. So those are really the 4 things. And we have great care for sick people. Once you get in the system, there is great care for you as a sick person, but there's not a lot of preventative stuff. Right? There's not a lot of preventative stuff, and you initially are going to be on your own, trying to figure this part out and go and getting where you need to go. That's from my view.
There's a lot of gaslighting around preventative too. You'll hear people saying, like in the kidney world, oh, prevention. You'll hear that. Mm-hmm. But you don't see any action around it.
Yeah, that is true.
There's no action around it. Like when Texas Kidney Foundation says prevention, we have an entire system around prevention.
Yep.
And it starts with early detection. People who really are putting their money where their mouth is, they're out there actually checking for prevention. Mm-hmm. They're actually doing things to prevent disease mitigation, to prevent disease continuing. So, you're going to have to be that prevention specialist for yourself.
Yeah.
Because our healthcare system, just the sheer facts and the numbers support that people aren't doing preventative. They're talking about doing preventative. They're not doing it.
Yeah, and then the other item that I see, right, is that there's a lot of emphasis on the individual, which you have to be the person to advocate for yourself. There's a lot of emphasis on the individual. Here's an example.
There's a lot of gaslighting.
A lot of gaslighting, right? So here's an example. Let's say you qualify for a kidney first. Let's say you qualify for a kidney transplant, right? Unless you get a caseworker, and I don't know what the percentage is on that. I'll have to go back and read. Unless you get a caseworker, you're going to be the person coordinating a lot of that, initiating a lot of that, having to do follow-up on a lot of that. A lot of times there are cancellations on the hospital's part, on the OR, and you got to follow up. And it feels like they're ignoring you because feels like that because sometimes that's what it is, right? From the patient's perspective. And you've got to be assertive and aggressive, but not belligerent, right? Because doctors are seeing it from their view, but you're seeing it from your view as well. And your view is life. You need life. And so you have to interact, and you've got to constantly remind yourself not to be belligerent because you're there, right? You've called.
Because your life is in their hands. That's why you have to remind yourself of that.
Yeah, you have to remind yourself of that. And so that's the part when I say you're on your own and you have to follow up, because and the gaslighting part is, hey, you didn't follow up with the OR. You didn't follow up with anyone, right? Not realizing, or maybe realizing that you had to go to dialysis. Dialysis it sucks your energy and your time out.
For most people.
Yeah, for most people, it is a big energy drain from you to do dialysis. And so that's the part where you've got to have either a loved one or you yourself have got to just go out and be very assertive around that part to make sure you get the appointment scheduled when it's there and that you follow up. And the other item, also around that, is that the timing that you take that medication is hyper important. You got to take it on a scheduled timer. Don't listen to these people who tell you, oh, it doesn't matter when you take it. It's important when you take the medication on the transport. You've got to be religious about that. And that only comes through self-education. The number of people that I meet in regards to that who feel like, oh, when'd you take your medicine? Oh, I took it a while back. No, you've got to take that medicine on time, on a set schedule, in order for your body not to reject that kidney. And you just can't go around. I met a gentleman who's drinking like a soda. I'm like, dude, that's the last thing you need to be drinking.
You'll meet a lot of kidney transplant patients who are drinking sodas and doing whatever. And part of that is the gaslighting narrative that everybody receives the entire time leading up to that, which is, this is on you. You don't have to worry about all of this stuff. Just do just enough. Mm-hmm. But that's not the way you wanna handle your health.